Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? We all know your nose is your face. We all know how important your nose is. And this episode is all about rhinoplasty. And I'm super excited to have Dr. Richard Reish from Manhattan on the show to tell us everything we need to know about rhinoplasty. Thank you so much for being on the show, Dr. Reish.
Well, thanks so much for having me. Super excited to be here today.
I am excited to really get into rhinoplasty. And I know you are the expert. Your Instagram is just loaded with before and after pictures. And you made a post recently about what you ask your patients to bring to the consultation. So you have an idea of what they're looking for. And I just thought that was so amazing that photo gallery is such a beautiful tool for your patients too.
Well, I completely agree. Thank you. And I think it's so important. So patients always ask me first, right off the bat, how do you pick a good rhinoplasty surgeon? Now, rhinoplasty is truly probably what I would say is the hardest type of surgery to do in all of plastic surgery. It has the greatest amount of complication rates. It can be a true disaster if it is not done the right way. Now, how do you know that you're going to a good surgeon? There's a lot of things to look into. First and foremost, this is a very different type of surgery than probably any other type of surgery in plastic surgery, in that you need to go to someone who truly does this every single day. There's an old saying that I always say about plastic surgeons in general, and it goes like this: Jack of all trades, master of none. That means if a surgeon they're doing tummy tucks and breast work and BBLs and all this other stuff and doing rhinoplasties, they're probably not that good at all of it, particularly the rhinoplasty part. In my practice, I truly specialize in just rhinoplasty. I do about 1,000 rhinoplasties a year. It is literally all I do every single day. I operate 5 full days a week. And to really excel in rhinoplasty, you really have to have a passion for it. Your surgeon has to think about it all the time. I mean, I dream about it. It's crazy. It's all I really think about all the time. And you really have to have that passion, that excitement. Every single case excites me, and I really get into it. And you really have to have that. And so, going back to your question, Mavi, it's a great question. In the topic that you brought up was photographs. And so a lot of my patients will say, how do I pick a surgeon? There's a lot of surgeons out there. First and foremost, make sure they do it every single day. How do you know your surgeon really does this surgery every day? It's pretty simple. Go on their website. Look at their before and after gallery. If they have a few pictures in their gallery, 30 or 40 patients, it's probably not enough, to be quite honest. There's some great surgeons that don't have that many pictures, but the odds are not in your favor. If your surgeon really doesn't have that many pictures on their website, probably means they're not doing it every day. And so in my practice, we have literally like hundreds and hundreds. We have over 600 patients in my gallery, and we do that intentionally so that I can show patients real results that are non-photoshopped, non-filtered, and what you can actually expect from these results. And so one thing that I like to do is my patients will oftentimes ask me, can I show you some pictures of patients I like? And I say, of course. Go on my website, find some real pictures of my real patients, screenshot them, send them to my cell phone. I'm always happy to look at those. Much better than using celebrities, Instagram influencers, models. All those people, they don't even look like their own photos. They use Photoshop filters galore. So it's really important that you focus on real photographs, real results. That's how you can find a good surgeon to do your surgery.
What a great reply, because I think that goes across the board for all procedures. If you're looking for a surgeon that to do facelifts or tummy tucks or any procedure, you want to see that they have a good amount of before and after pictures in their gallery of that procedure. You really, really do.
Yeah, I completely agree with you, Mavi. And another very interesting topic that comes up for me in consultations with patients all the time is they ask me about 3D imaging and computer imaging for rhinoplasty specifically. I personally don't do this in my practice at all. I view it as a very borderline ethical issue, quite honestly. Now, there are some good surgeons that use it, and I'm not referring to those surgeons. Unfortunately, in rhinoplasty, there are some not so good surgeons and some not so experienced surgeons who a patient will come in and they will simply hit a button on a computer. The nose looks perfect. They're showing the patients maneuvers that they've never actually done in a real human being. Like, for instance, if a patient has a giant long nose called an overprojected tip, they will deproject the tip closer in towards the patient's face. And they've never actually done that maneuver on a real human being, and they have no intention of actually doing that to the patient, but they need to sell them the surgery somehow. And that becomes a big ethical dilemma and a very dangerous situation for the patient, where the patient, unknowing patient, is coming in and, being sold surgery based on computer imaging, when in reality, they're not going on the person's website, not seeing all their photographs, and not realizing that that surgeon doesn't actually do the maneuver they're proposing in the computer imaging, and they're going to end up with a unsatisfactory result and end up getting revision. That is a big part of my practice. Unfortunately, I see it every day in my practice. I have patients flying in literally from all over the world for revision rhinoplasty, and I hear the same story every day. Is the patient felt like they got misled by their previous surgeon into doing the surgery based on 3D imaging. So I'm dead set against it in my practice. One thing I will say, just to be fair, is that I do have some respected colleagues who do 3D imaging, but they also have the photos on their website to back it up, and they're good surgeons. So you really have to, your listeners are so smart because they have someone like you to help guide them. A lot of people don't, though, and they don't do their proper research. And so it's just so important that you do research before committing to such a big surgery.
Absolutely. Because Dr. Reish, why don't you tell our girls about revisions?
Yeah. So revisions are literally half of my practice is revision rhinoplasty. So out of 1,000 rhinoplasties I do, over half of them are revisions. So it's patients who've had a primary rhinoplasty, their first rhinoplasty, end up with an unsatisfactory result, most commonly drooping tip, overprojected long tip, asymmetry in the tip or asymmetry in the nostrils, residual dorsal hump. Just basically, you didn't get what you want, or you can't breathe after surgery. And so it's a big problem. And it's commonly, I find, unfortunately, patients really didn't pick the right surgeon to do their surgery. And so they end up in this situation where revisions are much more complicated than primaries. There's a lot of scar tissue involved. And so it is not uncommon in my practice to have patients coming in for like their 8th or 9th different rhinoplasty. And it can get extremely complicated. You can have skin healing issues, blood supply issues to the nasal tip, tremendous amount of scarring. And so when you're in that situation, it becomes even more important to really find a revision specialist. And it can be a very frightening situation, stressful situation for a lot of patients out there. And so it just really emphasizes the great importance of doing research before finding a surgeon. And it also emphasizes the need to find a surgeon who also not just produces a lot of great results, but who's a nice person at the same time, and he's going to follow up with you. One of the things I love about my practice, to be honest with you, is that I give all my patients my personal cell phone number. People say I'm crazy to do it.
I love that.
When I was first in practice, older surgeons in my group, they said, you're insane. Don't give anyone your cell phone number. Stay away from them. Let the nurses take care of it. Let the receptionists take care of it. And I just said, no, I don't agree with that. I don't care if people are bothering me on Saturday or Sunday or a holiday. I would much rather hear from a patient who's stressed, who's worried about their results, who's worried about the swelling after surgery. I'd rather hear it from them right then, and I can help them. They'll send me a picture. And I just find it's a really good tool for patients to be able to have a surgeon who actually gives them their real personal cell phone number.
I love that. That's one of my when I'm checking a practice to see if I will refer to them, I always check and see, does the surgeon give the patient their cell phone number? Because to me, it's even if the patient does not use it, having that peace of mind of knowing that if I need to, I can always call my surgeon and I know they're going to take care of me. And knowing that that cell phone is by their bedside. So if you're calling in the middle of the night because you're freaking out and you're having an anxiety attack or something's happening urgent, you're not calling in a call center. You're not calling an answering service that you might sometimes take 24 hours to hear back or to talk to somebody. You're not doing that. You're getting straight to the source, straight to the source.
Yeah. And I completely agree with you. And it's interesting, as a prospective patient for the listeners out there, if you ask your surgeon or their office and you say, hey, if I have a problem, if I'm worried about something, how do I get in touch with you? And they say, oh, we have a service. It's 24 hours. You get in touch with me instantly through the service, this and that. I don't really buy that. Like you said, you're probably calling a covering person, a resident, a fellow, someone who doesn't even know you at all. And it takes 24 hours longer, sometimes weeks to get back to the patient if someone's on vacation. If a surgeon truly is giving out their personal cell phone number, patients ask me all the time, they say, well, what if it's the week? Should I really have surgery on a Friday? What if it's the weekend? There's a problem. I say, what do you mean? You already have my personal cell phone number. I give it out at the time of the consultation. You have an issue, you are texting or calling me directly 24 hours a day, and you're not talking to anyone else. You have a direct line of communication to your surgeon. And I couldn't agree with you more. I think that's just so important for patients.
That's wonderful. So Dr. Reish, okay, people are thinking about their nose, right? People or women or men who are considering a rhinoplasty might think or be afraid to make the move because we've all seen Michael Jackson's nose.
Yes. Unfortunately.
Okay. So for our listeners out there who maybe have been wanting a rhinoplasty their whole life, but have been afraid to pull the trigger because of the uncertainty of what it could possibly look like, tell our listeners, when somebody comes into your office, like, how do you make your assessment? How do you decide what you're going to be doing for that patient?
Yeah, it's a great question. And I think the fear is legitimate, quite honestly. There's a lot of really bad results out there with rhinoplasty. And once again, it all comes down to surgeon selection. You just really have to find an expert. It's so important, so important. I can't stress that enough to everyone listening right now. And really, when you're in the office doing the consultation, as a surgeon, I am listening. I want to assess a few things in the patient, which are super important things. Number one, are they a good candidate? Are they doing this surgery for the right reasons? And then really once you ascertain all that information, it's really getting down to what your goals are. And as a patient, the more specific you can be about your goals, the better that will communicate to your surgeon, hence the better outcome you'll be able to achieve with the surgeon. And for me, it all comes back to those before and after pictures. You really want to find a surgeon with a large gallery of before and after pictures. Therefore, they have proven their experience, proven their results. You like their aesthetic. And I always tell patients, you should go on your surgeon's website after seeing hundreds and hundreds of different patients. If you like the vast majority of those results, odds are you're in a place that you are going to end up with a very happy result for yourself. If you look on their website and number one, they don't have that many pictures, or God forbid, don't have any pictures, probably don't even consider going to that surgeon. But if you look at their pictures and they do have a lot, but you're starting to see a lot that you don't like, don't do surgery with that person. Don't be convinced that if you're not happy with their pictures, do not be convinced to do surgery with them. And certainly don't be convinced based on 3D imaging. I've heard that from so many patients where they say, yeah, I didn't really like their pictures that much, but oh my God, the computer image just looked amazing, exactly what I wanted. And I just asked them, I said, how did you decide to do surgery in that situation? Couldn't you just tell? And they said, well, no, I got misled by the computer imaging. So it just comes back to all the pictures. It's as you mentioned, it's so important for every procedure. For rhinoplasty in particular, I cannot stress how important it is.
Wonderful. So Dr. Reish, okay, let's pretend we're in a consultation right now Dr. Reish, I've always wanted to get my nose done. What does the recovery look like?
Great. Yeah. So it's about a week. Most patients get back to work in a week, back to the gym in a week, flying a plane in a week, because we have a lot of patients who come from out of state, across the country, overseas. And so it truly is about a week. Now, at a week, you're not perfect by any stretch of the imagination. I always tell my patients, it's about a B minus result at a week. You'll look in the mirror and you'll say, it's okay. It's not really what I wanted, but it's good enough to get me back out in public, good enough to get me back to work, back to school, do whatever I want at that point and feel pretty comfortable realizing it's not perfect at that point. The true final result is about a year and a half, actually. And so it truly, and sometimes it takes even longer. But that is why it's so important to have a surgeon who's going to be with you there for the journey. It can truly be a journey. And sometimes we have to do steroid injections and other things for patients. And so it comes back to, as we were talking about before with the cell phone, I'll have a lot of my patients a month after surgery, they'll text me a picture, a selfie on the cell phone, and I'll text them back and I'll say, no, don't worry about this. This is totally fine. It's just swelling. Let it go and just be patient. Or I'll say, no, why don't you come on in next week and we'll do some steroid injections to help get that swelling down.
Beautiful. Beautiful. It's so nice that they have that accessibility to you so that you can say, come on in. Let's take a look at it. Let's do something.
I completely agree.
So when a rhinoplasty patient wakes up, most of the time they have a splint on, correct?
Correct. Yeah. Yeah.
And how long does it usually stay on?
If they don't, there's probably something weird going on. So the splint stays for my patients. The splint stays on 1 week, and we take the splint off in the office a week after surgery. And then the patient is, when we have patients flying from all over the world that will fly home that exact same day, the splint comes off.
Oh, awesome. So they can fly as soon as the splint comes off. Do they have anything left on their nose, like tape?
No, great question. So there's a couple things I don't do specifically. Older surgeons sometimes will pack the nose. It is incredibly painful. It is an antiquated technique, in my opinion, that serves no function other than, quite honestly, to cause extreme discomfort to the patient. So we never pack internally in the nose. And then in my practice, I don't recommend taping or massaging the nose afterwards. I just recommend letting it be free at that point. If it's, if we need to do some steroids down the road, we can do so. Steroid injections, that is. But I don't recommend tape or massage. Just as an aside story, I've had so many patients come back in for revisions, and it's just sort of frustrating to hear as a surgeon, where the patients will tell me, no, I was taping and massaging my nose after surgery because that's what my surgeon told me to do. And then I came back in the office, my nose is all crooked, and the surgeon pointed the finger at me and said, you did the taping wrong. This is your fault. That's why you need a revision. And that to me is just so wrong. I have a no blame policy in my practice where if someone has a problem, I take care of it for them. I don't try to blame the patient or anyone else. I've had patients, for example, a patient who just had a gorgeous result, so amazing, was on my website 6 months after surgery, was in a bathroom door, and someone sort of kicked open the door real fast. She hit her nose, and her nose got crooked after that. And she's distraught, upset. They say, look, who cares? We'll take care of it. We're not going to blame you or blame anyone else for it. We just fix the problem. And so that's my philosophy about all this.
And that's such a beautiful, nice, warm hug for a patient, because Dr. Reish, I can't tell you, and I'm sure you know, how often patients get blamed by their surgeons for things that really are not things that the patient had any control over.
Isn't it crazy just to think about what you just said? And it's so true, unfortunately. It's not just as I'm sure you're well aware, from all of your patients and listeners. It's not just in rhinoplasty. It's in all different types of surgery where it's oftentimes there's a blame game that goes on where surgeon will blame the patient for things that it's shocking for me to hear as a surgeon what sometimes patients are told when I know it's not true at all in terms of why a complication occurred. And I just know it's 100 as a surgeon who has experience in these areas, it's just not true. And yet surgeons will still try to blame patients sometimes. It's really wrong.
Yeah, it is really wrong. And I've seen it actually with liposuction. And it's one of those things that I tell my girls when they're interviewing surgeons and when they're going to pick their surgeon, you want to make sure that that surgeon is a nice person. You know, you want to make sure that they're going to not gaslight you after surgery if something goes wrong or push the blame. And really, I love your approach of whatever it was, like, let's just fix the problem. If it's not figuring out who to blame, but let's figure out the solution. And that is so warm. Like, that's exactly what I'm looking for my patients, for my girls, to receive this warm, surgeon bedside manner. I love it.
It's such an important topic. I completely agree with you. And another question that this brings up, which is a great question for prospective patients to ask, is what is your policy on revisions? So rhinoplasty, tremendously hard surgery. Even the best of the best surgeons have to revise their own work occasionally. So most of the really top surgeons, we are really good at this. It's incredibly rare that we have to revise one of our own patients, but stuff happens. And even we have to revise some of our own patients on a rare circumstance. And what's your policy on that? And a lot of surgeons will say, which is fine to say, they'll say, oh, I won't charge you if we have to do it. But what they really mean is you still have to pay $5,000 in facility and anesthesia fees. I actually tell my patients, and this is never in any of our contract or writing because I'm personally part of a very large group. Other surgeons in my group don't do this type of thing. But I tell patients, look, I'll pay it myself. I don't care. It doesn't matter to me at all. We promised you a result. We're going to get you that result. And so I'll just take care of that fee myself every single time if it ever happens. And, it's a big deal for patients to have to do this stuff. And you really should be there for them, in my opinion, as a surgeon. And I know a lot of people don't agree with that in terms of the financial aspects, but I just like to eliminate that out of the equation and just, help patients when we can. Now, on the flip side, I will say, occasionally we try to screen for this prior to surgery, but sometimes you will get patients with unrealistic expectations who are in a situation where they truly have what I would consider, there's no perfect result ever. I try to eliminate that from people's vocabulary in rhinoplasty. There will never be a perfect result for anyone, but there's very good results, obviously. And I try to tell patients, if you're in the category where you have an extremely good result and you're just randomly asking for a revision or something of that nature, unfortunately, we have to be careful with body dysmorphia, especially in rhinoplasty. You want to be there and support patients and empathize with them and be along with their journey for them and try, even if they're having some issue where they just can't see how good their results is sometimes, you really do want to try to support them. But at the same time, you don't want to harm them by continuing to operate on them. But on the flip side, I will tell you this, being a revision expert in rhinoplasty, I have patients coming in my office all the time where they will tell me, I went to my surgeon and told him I was unhappy, and he handed me a card for a psychiatrist and said, that's the only person that could help me at this point.
Wow.
And I look at their nose, and their nose is awful. I mean, truly terrible, has so many issues with it. And I'm just like appalled. I said, if I was your surgeon, I'd be begging you to fix this instead of trying to shuffle you out of the office. There's just a lot of different
ins and
things
outs
to consider. Yeah, there's a lot to consider in all this.
The great thing, and I'm so happy to have experts like you and previous plastic surgeons that I've had on the show that are just so free and willing to give information, valuable information for our listeners so that they know what to look for. What are we even, I feel like just a few years ago, this topic was not out there as much as, like, in my opinion, your main priority is finding the right surgeon, and it shouldn't be whoever your friend went to because they got a good result or whoever so-and-so recommended. Like, you really need to do the research for your surgeon specific to the procedure that you are looking for and considering. And don't go just because they're close by or because their price is very low and affordable, which should be an instant red flag of why is their price so cheap. We know that usually means that corners are being cut, whether that be in the operating room or in the expertise of the surgeon. So red flags of low prices, it's not the time to bargain shop when you're talking about your body. Whether that be your mommy makeover, your facelift, your rhinoplasty, it is not the time to bargain shop. So this platform I'm so happy to have it, to be able to talk about these things that, in my dream, when I thought about the podcast, I thought I want it to be like girl talk, like they can hear, or we can talk about the things that we talk about in the office, because if like the general public knew what's going on, and it could help them make better decisions on, don't have a tummy tuck in the back of somebody's office. You need to be in a surgery center, in an operating room. And those are things that you would think are common sense. But when you are a patient and you don't know anything about anything, you have no idea where to start, where to look, like if you're even doing things right. And I'm so happy to have this platform. And I'm so happy to have you here, Dr. Reish, to talk to us and share your knowledge.
Well, I completely agree. And you're doing a great service for a lot of people out there. It's just wonderful to empower patients and educate people. It's so important. And something that you just said really rings true to me. I'll give you an example. We have a lot of patients who are teenage patients getting rhinoplasty and getting revisions even as teenagers. And it's a lot of Gen Z patients, getting these revisions. And it's a interesting situation because exactly what you just said, the patient's mother, for example, had a great result from their breast augmentation that they went to their local plastic surgeon, and then they say, oh, well, I had such a great result from my breast aug, I'm going to send my daughter there for her rhinoplasty. And then rhinoplasty turns out horrible. And then it's a whole mess. And it just goes back to finding someone who's actually an expert in a given procedure. And it's so important what you're doing and the work you're doing to educate people on the fact that they really need to do their research and not just go based on one friend's referral, and certainly find procedural expertise, not just general expertise, but very specific procedural expertise. Couldn't agree with you more.
Dr. Reish, I am so happy I had you on the show today. If my girls want to come see you for a revision or for a primary rhinoplasty, where can they find you? How can they find you?
Probably the easiest way, quite honestly, is on Instagram. Just look me up on Instagram. It's Richard. My last name is Reish, Reish. And just, hit me up on Instagram. I'm very easy to get in touch with. Can DM me, message me. And then my office is great. They'll get right in touch with you. And we try to make it very easy for patients too these days, in that we do a lot of virtual consultations. We, of course, do in office as well. But virtual consultations are just so nice for patients, especially for the nose. It makes it so easy. And, it's all about just giving patients a nice experience from the get-go. But I really, really applaud you, Mavi, for everything you're doing. And it's really impressive what you've done with this podcast. And I really appreciate you having me on.
Thank you so much. Thank you. I really appreciate that. I'm very happy to be here, to have you on the show and to be able to help women. I feel like this is my mission and I'm so happy to be here. So Dr. Reish, our girls will come look for you when they're ready for their rhinoplasty. Until then, we'll see y'all next week.
Thanks so much, everyone. Thanks, Mavi.
To all of my girls and guys out there who are on their plastic surgery journey and you have no idea where to start, I am so excited to tell you about the Beautiful Mind event and workshop. So what we're doing, you guys remember a few episodes ago, Make It Pop, and Big Butts No Lies are collaborating, and we're throwing a huge event. It's called the Beautiful Mind event, virtual and in person, May 19th and 20th here in Houston. And virtually, you can get your tickets and you can attend from anywhere around the world. You do not have to be in the US. You can be anywhere. You can purchase your ticket and you can join our virtual event. And let me tell you about this event. It is jam-packed with all-star speakers. Like, you guys, I'm hosting this event, right? A lot of our speakers have been on the show. We have the beautiful, beautiful Kylie Nutrition Plastic Surgery. We have the beautiful and very talented Dr. Redman. We have Dr. Azizi. He's going to be there. We have so many more. I am so excited about this event, you guys. We're going to talk about what to look for in your plastic surgeon, talking about different procedures. We're going to talk about nutrition. We're going to talk about recovery. Imagine everything that you've been scouring the internet for all in one place, one price, one worksheet, one information, and it's valuable, reliable information from board certified plastic surgeons and board certified providers. This event is a one of a kind. There's nothing out there like this, and you guys cannot miss it. So the tickets are on sale now. You can visit www.makeitpopusa.com and you're going to find the join the wait list. You'll start getting your information for the event. And to top it all off, are you ready for this part? We're having a watch party here in Houston for all of my girls who need that one-on-one help, and you're here in the city or even surrounding areas. You cannot miss out on this event because it's going to be in person on the 20th of May. We are going to be having a workshop. So we're going to go over all of the stuff that I just talked about, but in person, and you're going to be able to have a virtual or in-person consultation with a board certified plastic surgeon. Did you hear that? And it's included in your ticket price. You can have a consultation with a master injector. You heard that right. You can have a consultation with massage therapists giving you information. You can have a consultation and hear everything and anything that you need for your plastic surgery journey. You cannot miss out on this event.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.